Hello everyone, welcome to the Valley News Now desk. Duke Schindler here, joining you here on this Tuesday afternoon. Yeah, it's Tuesday here, I believe. And we're going to dive into some Investigate TV here today, as caregiving, certainly one of the fastest growing medical needs in our country right now. But it also comes with high costs. As Investigate TV, they're going to take an in-depth look at the struggles these hidden healthcare workers face, and they're seeking solutions for more resources and support. But on top of that as well, popularity of e-bikes and e-scooters is certainly on the rise as well, but so are visits to the emergency rooms. And then finally, they examine the risks for the riders, as well as a mother who shares her heartache to prevent another tragedy. Here is Investigate TV.
Today on Investigate TV Plus, caring for caregivers.
Ready?
It's a moment that plays out at homes across the country. A loved one provides unpaid care for someone who relies on them for their basic needs, and yet they never receive a dime. And help can come at the expense of their own health and financial security.
Is there a caregiving crisis in this country?
Absolutely. There's an urgent crisis in this country.
We take an in-depth look at this hidden workforce in healthcare, the search for solutions at the state and federal levels. Plus,
you struggle with having to hold up the whole family.
we reveal one caregiver's overwhelming reality.
Then affordable, fast, and dangerous. The popularity of e-bikes and e-scooters is soaring, but so are visits to emergency rooms from the people who ride them.
I'm just calling to tell you that both your kids were hit by a car. They were on their scooters.
We examine the risks for riders, and a mother shares her heartache to prevent another tragedy.
And making connections and encouraging smiles. A program inspires people to heal lonely hearts.
In-depth stories that inform and inspire. You're watching Investigate TV Plus. Caregiving for a loved one, it's not just a good deed, it's a public health issue. I'm Lee Zurich.
And I'm Tisha Powell. New research reveals 1 in 4 U.S. adults currently serve as caregiver for a relative with complex medical needs, and most family caregivers are unpaid. But advocates say this invisible workforce in healthcare is desperate for help.
Reporter Heather Graff shows you the search for solutions at the state and federal levels, plus one woman's daily reality amid concerns that a caregiving crisis isn't looming. It's already here.
It's just past 6 a.m. on a rainy morning in Maryland.
The day is the 13th.
And Pamela Talley has been awake for hours.
Cold coffee, it still works.
Cooking, cleaning, prepping, packing, and generally going nonstop.
Good morning.
Because once her son is awake, he's the priority. Xander is autistic and has minimal language skills.
Ready?
His daily routine, largely reliant on his mom.
Can you eat a couple more spoonfuls first? Cap.
Yet even after Xander boards the school bus,
Have a good day.
for Pamela, there is no time to waste.
One down.
A caregiver not just for her child, but her husband as well.
It's having to be everything to everyone.
You see, Kenneth Talley has Alzheimer's disease.
This is his memory patch.
And by 8:30 a.m., Pamela's focus has shifted to her spouse's medication management, blood pressure monitoring, upcoming doctor's appointments, and personal grooming, like shaving Kenneth's face. All of it now falls on Pamela.
So you got a lot on your plate.
I have a lot on my plate. I do.
The family photos that are ever present in this house,
This is a picture of my husband and I on our wedding day.
a reminder of what was before they got Kenneth's diagnosis 2 years ago.
It took my breath away, honestly. He was my co-pilot, you know? We co-piloted this life together. And I thought, how many more memories are we gonna have? You know, how am I gonna support the whole family through this? And there was just so much to get done.
Such is the demanding life of a family caregiver. And as of 2025, the National Alliance for Caregiving says 63 million Americans are doing just that. This new report warns of a dramatic increase in the number of caregivers nationwide, up by 20 million since 2015, as people are living longer and the U.S. population is aging.
Is there a caregiving crisis in this country?
Absolutely. There's an urgent crisis in this country.
Jason Resendez is the NAC president and says the organization's research also revealed family caregivers are stretched thin. Despite having virtually no medical training, they spend on average 27 hours a week caring for loved ones with chronic health conditions, allowing them to age at home and avoid costly long-term care facilities. Meanwhile, emotional and economic strain are widespread among the caregivers themselves.
Going into debt or reducing savings or even leaving the workforce due to caregiving.
If the faucet just stays on, it's just going to run out.
Pamela knows that struggle because she stopped working years ago when it became clear her son needed more support, and her husband is now retired.
Caregiving is very expensive.
In fact, when we shared with her this AARP study that found family caregivers spend an average of $7,242 annually on out-of-pocket costs related to caregiving, Pamela said this.
When we think about safety equipment, adaptations, bringing in help, the cost can be a lot higher than that.
One of the key challenges that family caregivers face is a lack of supportive infrastructure. From a healthcare perspective, from an economic perspective, from a mental health perspective, we need a regime of policies.
One policy the NAC supports is what's known as the Credit for Caring Act that's been repeatedly introduced on Capitol Hill. It would provide a non-refundable federal tax credit up to $5,000 for eligible family caregivers. Democratic Representative Linda Sanchez and Republican Senator Shelley Moore Capito are among the bill's bipartisan co-sponsors and say it's personal in part because both lawmakers helped care for their own elderly parents with Alzheimer's.
I know from my own personal struggle, wanting to do it the right way, it became incumbent upon me and my brother and my sister to care for them.
Both my mother and my father lived with Alzheimer's for many years, and it was always their wish to stay at home as long as possible.
In advocating for that legislation, nonprofits like the Alzheimer's Association acknowledge they also have ongoing concerns about cuts to Medicaid and caution the caregiver tax credit on its own is not nearly enough.
We do see it as a critical step forward. Of course, more has to be done.
How would you respond to that concern?
I think the expectations that you're going to do everything the first time in its entirety are going down the wrong path.
Yeah, I mean, it isn't meant to be a silver bullet, and if it doesn't happen this term, there's always next term.
The federal proposal so far has not advanced, but Oklahoma in 2023 became the first state to adopt a comprehensive caregiver tax credit up to $3,000, and Nebraska passed similar legislation in 2024.
The state work is critical, but ideally we would have both.
ID, insurance cards, medications.
For Pamela, it's still a constant juggle between her husband and son. But since Kenneth is a veteran, they eventually secured some in-home assistance through the VA.
Companion care coming today at 10 o'clock.
A stopgap for this family, but not a solution.
It's been a pretty tough road.
And on behalf of all caregivers, she says it's past time for this country to act.
We're all going to be touched by the caregiving experience, one way or another. They deserve our support. They need our support.
The Center for Retirement Research at Boston College has actually studied potential support policies for family caregivers, things like tax credits, paid family leave, paid respite care, reimbursement for out-of-pocket costs, or direct payments from the government. The center recently surveyed caregivers about what type of support would help the most, and found 44% would prefer assistance in the form of direct payments. But the bottom line, according to the national advocacy group Justice and Aging, is that state and federal lawmakers need to be thinking big.
I don't think it's just one solution. We need many solutions, like improving the availability of at-home care through the Medicare program. And then there's also social insurance type options that go beyond Medicaid and Medicare, like that we see in Washington State.
That example she mentioned out of Washington State is a first of its kind long-term care insurance program that's funded through a new state payroll tax.
Still ahead, remembering Rome, a couple compelled to fulfill a need after suffering a deep personal loss. We'll show you how they uplift new parents by providing a basic but costly necessity.
But first, road hazard. They're a fast, convenient way to get around town, but
people are getting very seriously hurt. Ruptured spleens, concussions, facial fractures, deep lacerations.
we examine the surge in e-bike and e-scooter injuries and solutions to prevent accidents.
You can watch Investigate TV Plus anytime online. Just subscribe to our YouTube channel at Investigate TV. You can catch stories and full episodes.
You've probably seen them parked on the side of the street, or maybe you've been sitting in traffic when someone zips past you on a brightly colored e-bike or e-scooter. The use of micromobility, or small vehicles like electric bikes and scooters, has surged over the last decade.
Both are considered low cost and can travel nearly twice the speed of traditional bikes and scooters. But research by the Consumer Product Safety Commission found micromobility vehicles are increasingly becoming more dangerous.
Reporter Kristen Crowley examines the risks in one mother's quest to advocate for tighter safety regulations.
In March 2025, Kat Velasquez was at work when her phone wouldn't stop ringing.
I was like, who's this? And she goes, you don't know me, honey. I'm just calling to tell you that both your kids were hit by a car. They were on their scooters.
Las Vegas Metro Police say her 22-year-old son, Christopher Soto, and his 14-year-old brother were riding their e-scooters when they entered an intersection and collided with a car. Kat says she sped across town to find out what happened to her sons.
I didn't know if both my kids were dead. One. And when I got there, they had all the streets blocked off.
When she arrived at the hospital, a nurse pulled her into a private room. She was told her youngest son, Carlos, was in bad shape and would need months of rehabilitation.
His injuries, some will heal, some will not. He still has a gouge of his skull kind of indented, and the doctor told him that he'll never get vision again in his eye.
As for her eldest son, Christopher, he did not survive.
She told me, I'm really sorry, but we tried everything, and we could not bring Christopher's heart rate back.
Christopher and Carlos are part of a troubling national statistic. Researchers at UC San Francisco report a major national surge in accidents involving e-bikes and e-scooters. E-bicycle injuries mostly doubled every year from 2017 to 2022, while e-scooter injuries rose by 45% each year.
If you're on an e-bike and you get in an accident with another vehicle, you're not going to win that accident.
Sunny Johnson is a supervisor for Honolulu EMS. She's witnessed firsthand the harm e-bikes can cause.
People are getting very seriously hurt. Ruptured spleens, head injuries, concussions, facial fractures, extremity fractures, deep lacerations.
Johnson says riders suffer more severe injuries because of factors like a lack of self-stabilization, uneven acceleration, and higher speeds.
It's even more important when you're going quicker to be attentive, be aware of your surroundings, and ride in a predictable and visible manner.
Malia Haranaga echoes Johnson's concerns. She's the Hawaii Bicycling League's director of adult education and teaches people the proper way to ride. Haranaga believes it's crucial for riders to get to know their e-bike, and she urges everyone to wear a helmet.
We always advocate for going, starting slow, getting familiar with that bike before you get riding on the streets.
To ensure riders follow the rules of the road, police in Henderson, Nevada work directly with schools to educate students, parents, and staff about the risks and laws.
If your child's operating an electric motorcycle that looks more like a motorcycle and not like a bicycle with pedals, if they're operating to from school, it's going to be an issue.
And Henderson Police Traffic Sergeant Richard Paul says that it's not just kids who face consequences. Under Nevada state law, parents and guardians can also be held liable if their child is caught riding illegally, which means they could face citations.
They don't really realize what they have their children out operating with.
Back in Las Vegas, family and friends built a makeshift memorial in the memory of Christopher near the intersection where he lost his life. His heartbroken mother says she drives by daily. On the pavement, the painted outlines of where her son's scooter came to rest are still in the road.
I can't believe it. I cannot believe my son is dead. My Christopher is gone.
She says it serves as a painful reminder of the agony of losing her eldest son.
As of October 2025, at least 28 states and Washington, D.C. have enacted e-scooter laws, and nearly 4 dozen have some form of regulation for e-bicycles. These laws and regulations address various aspects of use, including age restrictions, speed limits, designated riding areas, and helmets.
Still to come, a cheery crew
Connect with each other.
embarks on a serious goal.
Like, what other issue affects half of us?
We explore their solution to end an epidemic of loneliness.
But first, after a couple in Michigan suffered a heartbreaking loss, they took their grief and transformed it into a meaningful mission.
We just want to help people, and this is the best way to do it.
We'll share how they're honoring the memory of their infant son.
Our in-depth coverage continues. You can get connected to Investigate TV Plus on all social media platforms.
The birth of a baby can be a joyous time for new parents.
But some moms and dads are literally living diaper to diaper, unable to afford an essential baby supply. 1 in 2 families struggle to provide children with clean, dry diapers. Tara Waldron with the Junior League of New Orleans says the high cost of diapers forces some families to make painful choices.
When you have to choose between putting food on the table or a clean diaper for your baby, right, that's a really hard choice because there's no right and wrong answer. It's just hard.
Waldron says some babies require up to 10 diapers a day, which adds up to about 300 a month.
Reporter David Andrews shows how a Michigan couple is helping fulfill that need while also filling a void in their lives.
We've had a couple of my coworkers drop off some bags of diapers.
And they're starting to pile up on Chelsea Hester's kitchen table in Potterville.
So we just kind of wanted to give back to the community for people who can't afford diapers.
This is just the beginning of a week-long collection effort called Rome's Diaper Drive. And that's Rome, huh?
Yep, that's Rome.
Born premature and fighting to survive.
And then here's his tiny little foot.
Rome came into the world on July 11th, 2024.
He was 2 pounds, 7 ounces, and this is a preemie 1.
Rome didn't get to wear very many of these tiny diapers. He passed away after just 1 week.
It was the worst thing you could ever imagine.
Just sucks.
That's Rome's dad, Jason Lyons.
We just want to help people, and this is the best way to do it.
Rome's Diaper Drive celebrates their son's heavenly birthday.
That's his moo cow.
It goes for 1 week, the 7 days Rome was alive.
It's very hard if you have a child pass away. It's probably one of the worst things you'll ever experience in your life. But this just kind of helps us keep him alive in our own little way. Yeah, I think it's a great start.
Chelsea and Jason say all the diapers they collect will end up here at the Crystal Ray Diaper Bank in North Lansing.
Chelsea wanting to do this wonderful thing in memory of Rome.
Catholic Charities CEO Joe Garcia says it's a great cause because the need is great.
Every day, people are coming over here asking for that help. Diapers are expensive. Diapers are expensive.
But here they're free to parents in need, something that was important to Jason and Chelsea as they strive to keep their son's memory alive.
Definitely not forget him.
Definitely not.
Up next, a place to belong.
There's so much going on in the world, and sometimes we feel insignificant.
We meet a group inspired to create connections and end loneliness.
You can watch Investigate TV Plus anytime streaming online. Get the app for Roku, Amazon Fire TV, and Apple TV. It's free to download. In the spring of 2023, the U.S. Surgeon General declared loneliness a public health crisis.
Reporter Deborah Alfarone introduces us to a group inspired to end the loneliness epidemic by spreading a culture of belonging.
Connect with each other.
Walk down this Washington, D.C. street and you can't miss the smiles, bubbles, and good vibes of this small but mighty crew.
Thank you.
But these cheery volunteers have a serious mission.
We know right now that 1 in 2 American adults say that they experience loneliness. And I think to myself, what issue affects literally 50% of American adults? Like, what other issue affects half of us?
Becca Bernstein is Chief Community and Operations Officer for Belong Center, a nationwide nonprofit with the mission to end the loneliness epidemic and literally save lives.
Social disconnection leads to increase in stroke, increase in heart disease, increase in depression, even increase in death. I think a lot of people think of loneliness and belonging as these sort of fluffy, nice to have issues. These aren't nice to have issues. These are at the crux of our health and our well-being and our humanity.
We sat in as Becca led a group of volunteers in what's called a Social Connection Core activation. They're getting ready to go out and perform what's called Rascals, or random acts of social connection and love. One team hopped on public transit, handed out these connection cards, and created community through a game of Pictionary. The other team hit the streets, engaging people and also handing out those connection cards. Sure, some kept walking, but more often than not, people took the cards. Some shared.
My way of making the world a better place. I mean, there's so much going on in the world, and sometimes we feel insignificant.
Even if walking around, handing out cards isn't your thing, Becca says there are ways you can connect with others in your community through your own rascals. Visit your elderly neighbor, call an old friend. Your small action could change a life.
We had someone in our community who bought someone a coffee in line. The guy immediately got tears in his eyes and he said, you know, my dad's in the hospital. It's almost like you knew. But I didn't think anyone cared, but in this moment I feel like someone cares.
You know, they're doing such great work. You never really know what's going on with other people. Just be kind, engage, have a conversation, you'll make their day.
Sometimes the easy, simple things can make people feel so much better. Yeah,
Okay.
all good things to think about. That's it for us here at Investigate TV Plus. I'm Lee Zur.
And I'm Tisha Powell. Thanks for watching.
On the next Investigate TV Plus, millions of Americans are drinking water with elevated levels of toxins harmful to humans.
How does it make you feel that you have these chemicals in your blood right now?
It makes me feel mighty bad. I wish it had been discovered sooner.
We examine the risk as communities fight for accountability and answers.
All right, and that'll do for this week's edition of Investigate TV. Thank you all for watching here today. If you like what we're doing on the Valley News Now desk, make sure to let us know through Facebook or other means. Otherwise, if you don't have the VNN News app downloaded, get that downloaded on your smartphone or mobile device. It's available on their Android, Apple, or if you got a smart TV, might as well just throw on the VNN app. That you can get that on Roku, Fire Stick, as well as Apple TV. So you can never, ever miss another Investigate TV or whatever we're doing here on the Valley News Now desk. But for Duke Schindler, we'll catch you later.